session of Vishodhana 2020, international webinar on advanced research organized by Department of PG Studies in Rashastra Bhaishajya Kalpana and Dravyaguna, JSS Ayurveda Medical College, Mysuru. It's my immense pleasure to introduce today's guest speaker, Professor Dr. Shekhar Anambotla. Sir is the President and Chairman of Board Association of Ayurvedic Professionals of North America, Pennsylvania. Sir has been practicing and teaching Ayurveda worldwide since 1988. Sir is a founder and director of Global Ayurveda Conferences and Global Ayurveda Academy, which provides educational training in Ayurveda. Sir is a founder of Ayurveda Wellness Center OJAS and Dosha Botanicals. Sir has taught Ayurveda courses in many prestigious universities in the United States, including University of Pennsylvania Medical School, University of Medicine and Dentistry in New Jersey, Hershey Medical School, Jefferson Medical School, University of Penn Nursing School, and others. Once again, on behalf of our institution and Vishodhana 2020, I welcome you, sir. It's over to you.
Thank you. So let me share my screen. Share. Good afternoon to everyone, and good morning to everyone in the United States as well as other countries of the world. So thank you very much for inviting me as a guest speaker for this JSS Ayurveda Medical College, Mysuru, Karnataka, India. My today's topic on the evidence-based Ayurvedic formulations and global scenario. This is the very important topic, and worldwide where Ayurveda stands, how we can bring Ayurveda into the global platform, we are going to discuss in this 1 hour session. As I know that, as you know, all know that association affiliations with various institutions and universities and medical schools around the globe. So these are the associations with that. And this is the organization we established, and more than 14,000 members are there around the globe, 126 countries. Now we are expanding to that. And our goal to reach out to the 100,000 people means 1 lakh member of people to join in our organization as a largest global organization to establish on the earth. So how to bring Ayurvedic formulation global acceptance? This is the biggest question for everybody. Everybody wants to spread the knowledge and eager to spread the knowledge worldwide. Global acceptance is required, not necessary that now like internet access is available, Facebook is available, LinkedIn is available around the globe, YouTube and everything. Now where we are standing as Ayurvedic practitioners, as Ayurvedic graduates, we have a full training program in India and in other countries like Sri Lanka, Nepal. Full Ayurveda training programs are there. But these people are limited to only into their own countries, or they need to expand globally. That's the thing we are going to discuss. How to bring Ayurveda to global platform. That's very important. How to bring Ayurveda training global acceptance. This is also important factor. The language, communication, skills, and culture. These are all these things which has to bring into the forefront, and the stigma in our Ayurvedic professionals that not having a narrow-mindedness and broad-mindedness to bring open acceptance, then only we can bring the Ayurveda global platform. So if you look into the back into the thousands of years back, Ayurveda is the ancestral history is there. We always say that Ayurveda is the ancient system of medicine. 5,000 years, 10,000 years, millennia, Ayurveda is practiced. Are we in the same status now in 2020? 20th century, are we in the same status of millennia, people who are living there? The living cultures have changed. Our genes have changed. Viruses are changed. Our lifestyle changed. Our acceptance is changed. Our language is changed. Our lingo is changed. Everything is changed. We needed to be changed into according to the present scenario. So this is very important for us, all of us, to understand the concepts. Are you able to hear? Hello?
Yes, sir. You are audible, sir.
Okay, good. Why Ayurveda is not licensed as a medical profession in the Western countries? This is the common question I would like to ask everybody. Everybody asks that Ayurveda is a licensed profession or not. Of course, there are certain countries like India, Sri Lanka, and Nepal, where the full-fledged form of training programs are there. They are licensed professions. But still, there is an acceptance is not there. Public acceptance is not there. Full practice is there. And medical fraternities, such as Western medicine, which is allopathic medicine, is not fully accepting. So our Indian system of medicine, I'm going to discuss about that point also. And for example, we tried here a licensing of Ayurveda in Colorado State in USA. The government asked, these are the 3 points asked. Is there any side effects of Ayurvedic medicines? As a general Ayurvedic practitioners, teachers, and everybody says that there is no side effects, safe to use. That is wrong. It's utterly, completely wrong. There are a lot of side effects are there, which we are not ready to accept it. We are not able to document it. There are plenty of side effects are there, medicinal plants, and as well as metallic preparations has shown a lot of side effects, but we have not documented anything. Why? Because we are fearful. Oh, Ayurveda may be not respected well. That is wrong. Modern medicines having a lot of side effects. If you buy any medicine in the Western countries, the medicine effects they will give limited. The side effects are thousands. From the nausea, dizziness, giddiness, vomiting, fainting, coma, death can happen. These are the factors are there. There are plenty of medications in our Ayurvedic medicines having side effects, but we don't accept it. We don't tell the people like that. These are the side effects are there. If we don't tell them, we don't document it, how can we prove it? How can we protect it? As long as you say the safe medicine, then what happens? Everybody says that, okay, there's no need of license. There's no need of regulation. Similar, like, think about that. The bicycle riding, you don't need a license. As soon as you buy a motorbike or a car, you need a license, because that is a mechanism is there. That means people can die with that. Accidents can happen. Whereas bicycle, you may not be able to kill anybody, but we are allowed to drive in middle of the road? No, there are restricted areas not to practice. Similar way, we as an Ayurvedic practitioners, to show them, instead of showing the efficacy of the Ayurvedic medicines, we need to identify them. What are the side effects of each and every medicine? Every medicine, even ashwagandha. Licorice estimado in our any textbooks mentioned, not mentioned there, it enhances the blood pressure in contraindicated in blood pressure conditions. But whereas Western countries accepted like that, licorice whenever you are giving, you have to watchful about your blood pressure situation. So there are n number of medicines. There are plenty of medicines which we call as medicines or herbs or drugs and whatever the things are there. We need to establish that standards of scientific and also showing the side effects. Is there any legal law suits pending or present on the Ayurvedic doctors or professionals? This is the second question they ask. None. Basically, all the Ayurvedic practitioners are doctors who are taking the professional liability insurance in any Western countries. That means you have to be taking a professional liability insurance. Either it is $1 million, $2 million, $3 million, $5 million. That depends upon what type of practice you are doing and to protect the liability. Similar way, like a car insurance we take it, whether you get an accident or not, is a protecting yourself. Building insurance, if any fire hazards or happens, or slip and fall insurances, means somebody patients comes to your office and they fall down, they may sue you. That is the reason we take all the massage therapies, all the professions, medical doctors, that is called malpractice insurance or professional liability insurance. Everybody takes it. So in this situation, if anything lawsuit comes, any protected nothing, and then it will be taking care of that legal conditions, legal proceedings like that. So none, it has shown none. It may be having some incidences happen in the United States, in other parts of the world, but amicably, mutually understandable discussions like that, they resolve the issues. So if these conditions are there, then we need to definitely, there's no lawsuits are there. There's no side effects of the Ayurvedic medicines are there. So then why to give the license of Ayurveda profession? And there is no public threat with the Ayurveda professionals or medicines. Like earthworms. Earthworms, we are not worried about that. We are always worried about king cobras. Earthworm is a small snake. It is non-dangerous. It is friendly and supporting. That is the way we depicted our society, that Ayurvedic medicines, homeopathic medicines, Unani medicines, naturopathic medicines, yoga, everything is safe, 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 safe. Even the meditation. So everything is becoming a safe and medicine. Anybody can practice it without any formal training and educational background. And that is the reason we have mushrooming of all the Ayurvedic schools and Ayurvedic colleges and Ayurvedic education institutes around the globe is happening. More and more people are quacks, people are practicing, proper educational background is not there. So how to protect ourselves as a qualified people? Sometimes we are also not qualified completely. We are also quacks because we are not able to learn complete knowledge and everything, established knowledge has not there. I feel that some of the professors may feel not agree with that, but this is the truth, real fact. You have to rethink about that and think about the present situation. Since 33 years, 3 decades, I'm practicing Ayurveda. I'm a frank, direct. I understand there are so many flaws are there, or demerits are there. We are going to discuss those things also. That is the reason Ayurveda profession is not licensed. The reason is that it is not going to happen. As long as we don't show our medicines having side effects are there, processing is difficult for us, then until that, we cannot protect ourselves like that. What is complementary and alternative medicine? Complementary and alternative medicine, National Institute of Complementary and Alternative Medicine is established in the United States of America in Washington, because in the Washington state, in the USA, Ayurveda and other systems of medicines are alternative for their country. You can't say Ayurveda, yoga, and Siddha medicine are alternative medicines in India. Like I will give you an example. One guy went to Dubai, Saudi Arabia, from India, working there. He made a lot of money. Then he asked that, I wanted to take foreign goods which are made in abroad. Yes, sir, we will give you all the abroad goods for you. Foreign goods I wanted to share with my family in India. What they have given to him? Margo soap, Synthol soap, Ponds, and sandalwood powder. These are the things which are made in India and China. Those things are packed and give it to him. So he went happy to India and he shared with all the friends. Then he said that, what the heck you are doing? You didn't went to any abroad. Just you brought these things. So it is the thing way like that. We're looking for that. Ayurveda is not alternative medicine in India. Ayurveda is a native medicine of India. Western medicine is alternative medicine. Homeopathy is alternative medicine in India. In Germany, homeopathy is a native medicine. Western medicine, of course, in Western countries, we are taking as abroad, as all the countries, Western countries, we are taking, even the Asian countries, also Western countries. So this is the thing, anything West, East, West, and everything like that, North, South. But we are taking into the consideration of that, how this medicine is established and everything. So I feel that Indian system of medicine is Ayurveda, Siddha, and Yoga. These are the native Indian systems of medicine. Western medicine is called allopathy, conventional medicine, which is called evidence-based medicine, they call themselves, and that is allopathy. Alternative system of medicine in India, Unani, homeopathy, acupuncture. Acupuncture coming from China, homeopathy is coming from Germany, Unani medicine coming from the Arabic countries, Persian countries. So these are not considered as Indian systems of medicine. So this is the thing, Indian systems of medicine has to be taken to the different consideration way. Next, let us look into that. First, when the opium plant was isolated at the beginning of the 19th century, the era of modern drug began. In 1805, the first pharmacologically active compound morphine was isolated by the young German pharmacist Friedrich Schorner from the opium plant. So that means 215 years back, they identified morphine from opium plant. Now, they have expanded such a way that they are able to do all the modern surgeries with the derivative of this compound from the pharmacist who has developed this one. Then they have isolated, chemically processed, and they are able to do all the way of surgeries, anesthetic drugs, and everything they are able to do it. It is so pity that our Ayurvedic Shalya, Shalakya, surgical procedures people, they are using the modern anesthetic drugs, but we are not able to identify our own anesthetic drugs like modern medicine has developed. Why can't we develop our own anesthetic drugs? So I am going to discuss so many things like that for you, all of you. We need to rewrite all the Ayurveda training programs, Ayurvedic education programs, Ayurvedic flora, and everything has to be rewritten like that. And it has to be come into the global scenario, it will come. Otherwise, it will not be accepted as a global scenario. So merits of Ayurveda formulations. Of course, we are all know about that. These are natural. That means We will go to the jungle, pick up the medicine, any tree, bark, leaf, flower, root, and eat it. And that's it. Whether the action takes place today or tomorrow, day after tomorrow, any day it can happen, or it may not happen anything, or it may have some side effects are there, rash, something happened. We don't know. Then time tested. So we have principles are there in the ancient textbooks, which is called as Siddhantas. Siddhanto namaya parikshakai bahuvidam pariksha sadhayitva stapyate iti siddhantaha. These are the slokas we have by hearted, and we created this platform for us. Siddhanto namaya parikshakai bahuvidam pariksha sadhayitva stapyate iti siddhantaha. So these Siddhantas principles has made it in the ancient textbooks. We are following same thing. Charaka said this thing, Shushruta said like that, Vagbhata said like that, and Jayajata said like that, Gadadhara said like that. These are all the peoples what they have explained. Nagarjuna said like that. This is the way only we are talking. What you said, this is important for us. My grandfather used to be a great saint. I will not have the same qualities. This is the thing is very, very important like that. We need to think about that. We are always showing the tree, selling the fruits. This is the way we are doing. And affordable. Ayurvedic formulations are affordable. Why? Because these medicines have not done any stringent scientific studies are not done. That is the reason dozen tablets are available. Triphala you can buy in a whole bottle, $1. Whether it works or not, we don't know. We don't know. Even I have tried 7 tablets of Triphala. It's having a mild laxative effect. And some of the company tablets, I take it, maybe 3 tablets. What are the side effects? We have to notice this one. This is the very, very important like that. That is the thing I am very, very concerned about, that every medicine, whatever I give, I am not worried about the action. I am looking for the side effects. Until we don't know the side effects, we cannot explain to the people like that what is the side effects. We notice it like that. And then after that, effects will be shown. And of course, these medicines are Ayurvedic medicines are formulated and developed in India. These are the merits. Now, demerits of Ayurveda. We can go on talking about the demerits, but I don't want to, as a classically trained Ayurvedic doctor, I will not blame the system of medicine. The blame should be done only with us, with our profession only, not with the system. Lack of proper, larger scientific data. This is the biggest thing. I searched every books and everything like that. We have done the research about 15 patients, 20 patients, 30 patients. Where is the data is the pool is data is not happening there for us. Why we are not able to pull the 50,000 patients, like a COVID now situation? How many people are suffering in India? First, let us take all these things. One standard drug has to be come up like that. That has to be scientifically proven. Why we are not able to do it? What in Kerala gives the medicine is different. In Uttar Pradesh gives medicine different. Karnataka gives medicine. Everybody gives different medicines. This is the problem. And lack of stringent drug standardization. This is the biggest problem also. We don't have standardization of the drug. We don't know whether this product works or not. And a lot of times I ask them that which medicine I have to take. For example, somebody says that Tribhuvana Kirtiras or Samira Pannagaras. Anything in metallic preparations, Brihatvat Chintamani, or any herbal medicines like Triphala. First of all, I ask them which company I have to buy. Then somebody says that, oh, Vaginal is good. Dabur is good. Patanjali is good. Dut Papeshwar is good. Jhandu is good. And somebody locally manufactured, that guy will give. Where? Where the standardization of the drug? There is no standardization of the drug is not happening there. But ingredients are same. There is a spurious medications and flaw medication they are putting together like that. And I have seen the people who are spuriously, they are giving like that medicines. And I identified that in black pepper, I saw the papaya seeds. Why? Why we have to do this type of a cheating job when the profession is not developed? And then proper documentation. Proper documentation of the records is a very, very crucial, important, whether it is a positive or negative. Both things has to be taken into the consideration. So, drug and herb interaction. So, there are plenty of herbs which may interact with the herbs and drugs. A lot of people, medications, people are taking antihypertensive medications or diabetic medications or neurological conditions, Parkinson conditions, various conditions like that. They take the medications. How, what is the medication interaction is happening, drug and herb interaction? Where is the documentation of the books? Where we are doing millennia of the standard government officials, Ayush, Indian ministry, and all the ministries are there, where the documentation is happening. We don't have proper documentation. And then not able to explain scientific pharmacokinetic action. Each and every drug, how it is going, where it is going, how the stream is there. We are studying race anatomy, Cunningham's anatomy. We know the anatomy. We don't need to go into the ancient textbook of Sushruta anatomy like that, 360 bones and those things that we are not discussing like that. 206 bones, whatever the bones are there. Number is not important here. How well you are able to understand the knowledge, modern science of knowledge. Take the modern science of knowledge where the tools are there. And then you started to work on that, how each and every drug, how it will go into the system, bloodstream, in the breast milk, or in the brain and blood-brain barrier. So many levels we have to work on that. Lack of modernization of pharmaceuticals. We are going to dwell into that more discussed way like that. Modern pharmaceuticals, we have to use it. There's the pharmacy colleges, you can go and visit them, see these colleges, how they established like that. Biggest things like that. Not able to identify much side effects, which I explained to you earlier, and not able to do research in the larger quantities, larger data numbers and everything. This is also discussed like that. So these are the so many flaws are there. We have to flaws are demerits are there. These are the demerits. We have to rectify it from the core level, then understand the concepts and everything. Then only global scenario will come. Ayurvedic formulations has to be accepted like that. Even if you are making Tribhuna Kirtirasa, it has to be available in Somalia, Kenya, North Korea, all the areas, all the worldwide. It has to be accepted. Then only it can come into that formulation. Each and every formulation identify some problem of formulations, and then these identified formulations has to be stringently prepared and documented. Encyclopedias are created. That documentation has to be reviewed and put it properly into the global platform. This is the thing is very, very important. Even if I wanted to look into the online, anything information about the, for example, any product, there is not much information is not available. Only one page information, some sloka, some ingredients, and side effects, none. None noticed. Why? There's a plenty of side effects are there. This is the thing we have to look into that, how carefully we have to do it like that. Ayurvedic formulation should be made easily absorbable by the gut flora. This is the thing is important also. There are certain medications which are very, very disgusting, taking difficult like that, not properly taking like that. How it can be administered properly, it's a palatable way. And see that how many Ayurvedic doctors are taking their own, if they have any problems, health problems are there, they are taking Ayurvedic medicines or homeopathic medicines or allopathic medicines. First of all, when they get something problem there, first of all, they will rush to the allopathic hospital, not an Ayurvedic hospital. Because we don't trust our own system of medicine. The reason is that there is no scientifically proven. And blood-brain barrier, this is the area also we have to work on that. Herbal vaccines, we are talking about vaccine. And now, scientifically, we are proving like that ashwagandha having an immunomodulator effect. It is very good for the COVID condition. Why can't we make a vaccine of the ashwagandha? Give it to the patients. Ashwagandha, any form, you can look into that and give them. Or guduchi, which we are talking about, guduchi sattva, guduchi ghanavati we are giving. Samshamanavati we are giving. Why can't we make a vaccine to give to the COVID patients, selective patients, and give them? Vaccines are not a modern medicine. It's a technology. We are using the technology. So technology using is not a shame, but I am saying that here very clearly that we wanted to make our own vaccines, herbal vaccinations, injectables, intramuscular, intravenous. None of the pharmaceutical companies are manufacturing intramuscular, intravenous injections. Why? Why we are not able to make our own injections, Ayurvedic injections? Why? It is not, because everything we have to go through the stomach only. If the patient is comatose condition, how can you give the medication? Or if he is having a lot of vomiting, how can you give the medication? You have to give into the different routes. There is various ways to drug administration has to be done. And easily absorbable through the skin. There are so many medications which we can give through the skin. Skin is the largest organ of the body. And skin structure is there. Skin can absorb so many things. There is a lot of hormonal patches, contraceptive things, which can be done through skin. Where is an Ayurvedic contraceptive things? They may ask this Western people, doctors, they ask me here, Dr. Shekhar, do you have any contraceptive things? No, we have only things are there, anecdotes are there, some things are there, which is whether they work or not. Do you have any scientific data on that? No. Do you have any side effects on that? No. There's sublingual preparations. We need to prepare sublingual preparations. It's very important. It will go into the system very fast. Aerosol sprays. Aerosol sprays are very important. I have a concept in 1980s. When I was studying in Gujarat Ayurveda University, I asked my professor, sir, can we make my topic of the preparation is that I have formulation taken that way. My MD post-graduation thesis on the Devadaru compound. That is called Devadaru Vacha Vyagri Viswa Katfala Paushkarai Krutakwado Jayanti Asu Swasakas Avasheshataha. This is my MD thesis on the bronchial asthma Tamakashwas. I wanted to make this 6 ingredients. Devadaru Vacha Vyagri Viswa Katfala Paushkarai Krutakwado Jayanti Asu Swasakas Avasheshataha. This formulation, I wanted to make an aerosol spray, a nebulizer, which is having a Myristica fragrance is there, ginger is there, there is a lot of alkaloids are there, substances are there. My professor said, no. We'll give a kashayam because you accepted that whether we can do ghanavati. Ghanavati and kashayam both are good, fine. Other than that, you cannot do anything. But I bifurcated my way of doing like that. I did the 1980s, the Purnark extract form of the 6 ingredients I brought together. I put in a capsulated form. I started giving the patients. But it is not included in my clinical studies. Even though I have seen thousands of patients there, but I have not included in the clinical studies because it is not on par with the university norms and conditions like that. Why? Why we are going backward direction? We need to open up like that. And at the same time, the same drug which is administered to the animal studies, is there any side effects of these medications are there? Any animal studies are done? So this is the thing, we need to do animal studies. We need to do scientific studies. We need to do innovative modern technology. We have to utilize it and use the Ayurvedic formulations like that. This is the thing is very, very important for the global scenario to bring it. Next, drugs are introduced into the body various several ways. Drug administration. Taken by mouth, generally all the Ayurvedic medicines, majority things are given by orally, and the majority, kashayams, kwadams, panchavida kashaya kalpanas, bhasmas, all these things are given orally. How much is intravenous? Nothing. Intramuscular? Nothing. Intrathecal? Nothing. Subcutaneous? There is, and of course, subcutaneously we are applying some of the lotions and everything like that. So, rectally, not many, only bastis. We are giving some basti, kashayams and everything. That's the only thing we are doing. Vaginally, Uttar Basti, we do something. But how much scientific studies are done on Uttar Basti conditions like that, and how the drug administration is happened, how much is absorbed in the system, what are the side effects noticed, what are the structural chemical changes are happening in the structure like that. This is the thing is very important. There are a lot of medications which are giving eye drops. Of course, I use also some eye tone and netra bindu, so many things are there. How the pharmacological action is there, how much is absorbed, how much is this acceptance is there in the system, and how much ocular level it is going on. We have an Elanir Kurumbu, a lot of medications are there, eye drops. And nasal, sprayed into the nose and absorbed through the nasal membrane. We are having Nasya, Nasahi Sarasodwaram. It's clearly mentioned there. Nose is the gateway to the brain. How our Ayurvedic medications, a lot of medications can be given. Even we have aerosol sprays and a lot of nasal drops can be given for reducing the effect on the various conditions. Breathe into the lungs, usually through the mouth, inhalation or mouth, nebulizers, nebulizations, topical, skin, cutaneous, transdermally, patches. Why can't we make an herbal patch? We can call it herbal patch or herbo-mineral patch. If the combination is there, a lot of times even single herbs cannot be work well. Sometimes we need to use Jantava dravyas also we have to take in, animal products. Some of the times we have to take it, mineral products, such as rasaushadhas, which can penetrate in the system faster. Some of the times kastaushadhas we have to take it. So in combination of herbo, mineral, animal products can be administered. In mode of action has to be changed, and how it is absorbed in the system. Laboratory investigation has to be done. This is the job of the Ayurvedic Dravyaguna experts and Vaishajya Kalpana and Rasha Shastra experts. This is the job. And Sarira Kriya, Sarira Rachana people, they have to look into that direction. These Kaya Chikitsa people and Prasuti, Sri Balaroga people, they are the clinicians. And Shalya Shalaka people, these are the clinicians, where they will go into these things. Whereas Siddhantas, principles are those people are there. They identify the correct version of the things, how the classical preparations are there, how it is given, and how it has to be, formulations are there, and how the things are there. Ancient textbooks, they read it and they bring it to the correct knowledge. This is the way teamwork has to be done properly like that. So recently, I was inviting the speakers to come and speak in the conference, a clinical Ayurveda conference, happening in the month of next month. A lot of speakers, they applied MD Sarira Rachana, MD Sarira Kriya, MD Roganidhan and Vikrut Vignan, These are the people are applying for the speakers in the clinical Ayurveda, where the clinicians are not applying because they don't have proper documentation. And like we see the Western medicines, an anatomy professor will not go and sit in the general medicine ward or see the patients. This is also pity. A pharmacologist or pathologist will not see the patients. So this is the way we look into the direction that why I have to non-clinical and clinical subjects are there. More and more research work has to be done like that. Oral drugs, liquids, capsules, tablets, chewable tablets, we have to find it. This is the way we have to work on that. And palatable and tasty and everything like that. Easily absorbable and effective. There are some chewable tablets are there, Kantasudha, those type of things are there. Talisadi, Sitapaladi, those tablets can be chewable. More tastier, children friendly. In pediatric cases, it's very, very difficult for me. I have a lot of pediatric children, they come. I have, my hands are tied. I don't have much medicines for them, offer. And particularly autistic kids and everything like that. It's very difficult to give the Ayurvedic medications for the children. So this is the thing which has to be remodified and absorbed into the system very well like that. Administered orally, absorbed into the mouth and stomach and everything. This is the transfer bloodstream has to go and look into that direction. Then these are the drugs which are orally, a lot of medications are these things. Some drugs should be taken an empty stomach, some others should be taken with the food, and they can interaction, drug and food interaction can happen. Drug and food interaction, Ayurvedic herbs and drugs and interaction. Ayurvedic drugs and Western drugs interaction. These are the things all to be taken. Some orally administered drugs initiate in the digestive tract. Some are nullifies their effect. How the digestive system are reacting on the each and every product. This has to be developed more. Other routes of administration required when the oral route cannot be used. For example, when the person cannot take anything by mouth, which I explained to you, vomiting, profuse vomiting is happening. We can't give any medications. What should we do? Even he cannot take Madhipal Rasayana or some Laghusutra Sekhar Rasa or anything like that. What we do? When the drug is administered rapidly in the precise and very high doses, when the drug is poorly erratically absorbed from the digestive tract, this is the reason they cannot be given properly. We have to find out all the pharmacological, pharmacokinetic action of each and every drug and herb in Ayurveda. Injectables, which I explained to you earlier, subcutaneous, under the skin, intramuscular, in the muscle, intravenous. None of the medicines, Ayurvedic medicines having that's the thing there. I'm going to show you some of the scientific data which has ICMR has identified, Indian Council of Medicine has identified, pharmacologists are identified, PubMed has publications, so many publications are there which has shown very effectiveness of the Ayurvedic herbal formulations in various conditions, which has proven. Why can't we adopt those things? We are again, three sects are happening there. Here, pure Ayurvedic doctors, Ayurvedic practitioners, the pharmacologists who are pharmacy development, pharmacologists are there, they're isolating the extracts and everything they are doing. Of course, there is a medical doctors in the pharmacology department, there is a medical profession like that, they are doing synthetic medications, chemical medication they are making like that, paracetamol and those type of things, crocin. So those are the synthetic medications are made. Synthetic and extracts, raw form. These are the three levels are happening there. So we are not able to reach the middle level which are developed from the Ayurvedic perspective. These things, they may be not following Ayurveda principles. They are taking an extract form. But at least you show the results for the people. Side effects you show them, no problem. But system has to develop more. Subcutaneous drug reaches the bloodstream to the lymphatic system. This is the subcutaneous level it works. We have to go into the subcutaneous level and lymphatic system has to work. And subcutaneous needles inserted into the fatty tissues beneath the skin after drug is injected in the proper way it goes. Certain drugs such as progestins used in the hormonal birth control may be given inserting the plastic capsules under the skin, implantations. These can stay for longer time. So these can be implantation Ayurvedic herbal safer. So if modern medicine having 40 side effects are there, if we have only 10 side effects are there, people will prefer to come to us. But at the same time, more effectiveness is there. We have to validate the system like that here and there. This is the thing is very, very important for us, to crucial to understand the global. If you wanted to bring the Ayurveda global scenario, this is the only way, best way to go. Intramuscular route, which is I explained to you, because the muscle layers on the skin, fatty tissues, a larger needle is required. Drugs are used injected upper arm and thigh and buttocks. These are the areas we generally give these injections like that. And subcutaneous and it's an intramuscular ways it can be given more. Intravenous, the medication has to be given intravenous, single dose continuous infusions. So we have a lot of things are there. We are not able to make our own formulations with intravenous injections. So we have to try. We have to try. We have to give. We have to do experimental studies. India is possible country where you can do a lot of studies can be done. That is the reason we are able to do it more and more countries and giving the vaccinations and everything. The third world countries, they are giving, developing countries where they give the medications like that, drugs and everything, and to see the efficacy of the medications like that. We have to look into that more and more scientific way to look into that. We have to collaborate with the pharmacologists, pharmacists. These are the people we have to collaborate with them to create the Ayurvedic Dravyaguna experts and Rasha Shastra experts, to collaborate with them to work with that. Pharmacy collaboration is very, very important. Each and every drug has to be identified and properly, and drug interaction has to be done properly. Intrathecal rate of needles inserted with the vertebra into the lower spine, into the spine space around the spinal cord. This is the thing also, pity thing, that a lot of people who are surgical procedures, they are doing like we are doing parasurgical procedures, basically Chara Sutras and simple surgical procedures like that. What we are using? Anesthetic drug. We are using Western anesthetic drug. Where is our herbal anesthetic drugs? How we can use it? It is not proven. We are not developed. Oh, we don't have funding. We don't have funding. All the time we are always crying money, money, money. We don't have money. We don't have money. This is the only way they do it. Think about that. We wanted to be beggars all the time. Anesthetics and all analgesics are very, very important for us. We have to work with that. And sublingual buccal, a few drugs can place it under the tongue, taken sublingually between the gums and teeth, buccally beneath the tongue. There are certain herbs which are mentioned that. When I will talk about that. These drugs cannot be swallowed, sucking, like sublingual route, especially good for the glycerin, which is relieve the angina because absorption is rapid and drug immediately enters in the bloodstream without fast passing through the intestinal wall or liver. Where is our Ayurvedic herbal nitroglycerin? How it can be acting? Where we can give? What formula is good? This is the thing we need to identify them. The most drug cannot be taken this way because they may be absorbed incompletely and erratically. This is the thing is very, very important. Rectal route, lot of medications we can give suppositories. Where is the Ayurvedic suppositories? We don't have any Ayurvedic suppositories. Why can't we create our own suppositories? Like we have a lot of things. Senna is there, Sonamukhi. We have also Triphala is there. We have Haritaki is there. These are the things which you can take in a bulk promoter and Virechana Dravyas. Any Virechana Dravyas you can take it. It's not necessary that they have to work from there. Castor oil and extracts can be taken from that. Make a suppository. And people who are constipated, they insert this herbal suppository, insert into the system, and see the effect. What is the effect on the mucosal layer in the rectum? How the blood-brain barrier is happening? How much fast it is acting? A lot of doctors, a lot of professionals, they ask me that, Dr. Shekhar, how much time it takes for me to absorb into the system and how the elimination is happening. And we are not having proper understanding is there. This is the thing is very, very important for us to understand the concept of things. We have to clean our house. The blood supply is rich. We know that, as we know that rectally we are giving basti therapies and everything we are doing. Matra basti, Kashaya basti, Yuktarada basti. So many bastis, Kala bastis, and so yoga bastis, so many Brahmana bastis, so many bastis we are talking about that. Where we have to do standardization. This is the standardization is very important for us. And there are certain drugs administered rectally, including acetaminophen, diazepam, and laxatives for constipation. For seizures, diazepam. For seizures, what type of medications are good? We are going to talk about that also in the later stages. The pharmacodynamics and pharmacological studies are done, various herbal formulations. We are talking about that. I am going to talk about that. Vaginal route. There are so many Prasuti and Sri Roga people. This is the people they have to address this area that we wanted to have vaginal route, some preparations. What is the thing, how it is working like that? And like solutions, tablets, creams, gels, suppositories, rings. This can be prepared. Ayurvedic herbal rings, Ayurvedic suppositories, Ayurvedic gel, creams. These are the things are there. People, women, they suffer with a lot of problems with the candida problems. And this is the problem of them. Then how we can make it, these things. We are, in the ancient time, I remember that when I was a kid, I go to one of the medical doctor at that time, a little kid. He's making the formulation in front of me, cough syrups, everything. And he give it the liquid form, tasty, and you take that one, immediate action. In small remote villages. Similar way, I was talking about almost 45 years back. The story about 45 years back, I was talking about that. We are in the same stage now. Even after 100 years also, later also, we are in the same stage. We are not changing. We are only, the way of speaking changed. The way of living is changed. Standards have changed. But our pharma industry is not changed. And they are slowly absorbed through the vaginal wall, and vaginal symptoms such as dryness, soreness, and redness. A lot of women, they complain about that they're having a menopausal condition. They have a dryness in the vaginal area. They don't want to use any creams and lotions. We tell them that, okay, come on, put some coconut oil, castor oil, and ghee. How it is effective? I asked them how the results is there. Not much. I applied. Some relaxation, something like that. But it's not a long-term effect is not there. We need to work on that. Ocular route. Ocular route is another way of using that in the glaucoma condition, conjunctivitis, injuries, and everything. This is the thing they have to think about the Shalakya people particularly. Shalakya people, they have to think about liquid preparations and the liquid gels and ointments and everything like that. These are the people they have to work with closely with the Draviguna and Rashastra people and pharmacologists, pharmacists, to make a manufacturing of formulation which can go superior, less side effects, and go administered easily. And there are some formulations which can be given, and high quality, how it is affected and how it is seen into the system clinically, and proven things we have to teach them. And then only our Ayurvedic graduates, on par with MBBS doctors, on par with MD Ayurveda, modern medicine people, they can able to practice. Otherwise, they will be puppets of talking about slokas, chanting of slokas, and making into the colleges like the teaching like that. This thing is going on continuously. This is not a way system of the medicine works. Our Prime Minister Indra, Narendra Modi always asks that scientific studies, to show to the West, to the world, we need a scientific data. You have to take, I'm not expecting you Ayurvedic doctors to do it, all the pharmacological studies. Don't do, that is not your domain. You ask the pharmacologist, pharmacist to work on that. There is a lot of studies are done. These are the things which has to work on that level to work on the preparations of the formulations. Gel preparations, ointments, keep the content very contact and everything longer time. These are gel preparation has to be prepared. Sometimes this may cause blurred vision. That is the reason we prefer the drops. Drops easy to put it. And but a lot of medicine will be lost. Because you put the drop, sometimes it may fall in 2 drops, you lose the medicine. That is the reason we have to have some creams, lotions. When I was studying Draviguna, my professor used to say that Drona Pushpi Anjana is very effective in the jaundice. See, jaundice condition, Drona Pushpi, Lucas aspera, is very good for the Anjana form. Maybe it is locally it is working because they may have a yellow coloration, discoloration of the eye, sclera and eye. That may be reducing the yellow discoloration like that. We don't have any scientific proven.
Vishal Chabriya.
Scientifically proven and effect showing that how it is going to be affecting on the eye, Alochaka Pitta level, and the Ranjaka Pitta level in the liver. How this is affecting that way. This is the thing also we have to take into consideration. Where the connectivity between the doshas, subdoshas. We are talking about so many doshas and connectivity with these things. That is the thing, Rashasha, that is the Sharira Rachana, Sharira Kriya people, they have to think about that. Is there any connectivity between the Alochaka Pitta and Pachaka Pitta and Ranjaka Pitta? That is the only thing that is their domain. They have to work on that. How it is working on that. Clinical evaluation has to be done. And next, Arctic route. Drugs used in the ear, inflammation. We have a lot of formulations which are there. For example, Karnabindu, Anutailam, Shadbindu Tailam, and goes on like that. But how effective it is in otitis condition, Arctic conditions, tinnitus, various conditions are there. Meniere's diseases, so many n number of diseases, ear disorders are there. In this ear disorders, we have any specific scientifically proven Ayurvedic drug I wanted. Proven. With side effects. I wanted to have side effects also. If somebody says that no side effects, sir, then I don't believe it. Because they have not done studies. They have not given various people. They have not done a big number of studies are not done. Side effects are everything. Side effects are there. Eardrops, people should be thoroughly clean the ears with the moist cloth and dry these things. Arctic root is a hydrocortisone, relieves the inflammation, ciprofloxacin, benzocaines. There are so many things which are there which can be absorbed in the system like that. Modern way they are doing. Why can't we do it in Ayurveda? Nasal route. Another administration of these things which I explained to you. The drugs administered breathed to the absorbed through the mucosa layer, mucous membrane, atomize, means the droplets of the air like that, atomize like that, a small droplet of the information like that, aerosol sprays like that, whatever the things with the nasal passages. Now, modern medicine is going beyond that level. When they are taking Viagra, a tablet, which is internally take it, and it is also having people who are having an problem of the heart problems and everything like that, blood pressure, those things can happen. In those conditions, what is happening there? Now, they cannot contraindicate it, Viagra. But what we have to do here, we have to come up with the Ayurvedic Viagra, which is aphrodisiac effect, sexual stimulant. People who are having an erectile dysfunction condition, those conditions, we need to come up with the Ayurvedic formulation, which can be very effective and less side effects. Less, I'm asking that no side effects, less side effects, and promising results are there. This is the thing is very, very important. Inhalation route. There are plenty of inhalation things are there which can be taken into the system. There are drugs can be prepared, Ayurvedic drugs, inhaling these things, and it will be very effective. Nebulization. This is the thing in ICU, in NICU unit, intensive care units, premature care units, pediatricians, as well as gynec doctors who are there, nebulizations are required. We need to come up with some Ayurvedic herbal nebulizers. This is the thing we have to come up with. These things pharma industry has to develop in collaboration with them to work on that. I'm not saying that to ignore the Shastriya classical formulations. We need to innovative way. We have to come up with some formulations which are having side effects are there, which has to be noticed, documented. Cutaneous route, which I explained about that. Psoriasis, eczema, skin conditions, viral, bacterial, fungal, itching, dry skin, and all the various conditions. Transdermal, which I talked about that. Now let us look into that. Modern research on the herbs. This is all compiled work. I did it. So when the compiled work, you look into that gastrointestinal system. I'm talking about these herbs, which are gastrointestinal system. They work. This guy. Okay. Antispasmodics, calamus root, vacha, brahmi, mandukapanni, haridra, bhumi amalaki, chitraka, and modern these things, cranberry, and black haw, and chamomile, ginger, passion flower, peppermint, hops. These are the things that are antispasmodics. These are the scientifically proven. I'm not talking about in between like that. These are the acharyas who are scholars who have done like that. Why we are respecting our Jejata and Vagbata, Gadadhara, and all the Chakrapani and all the people. We have a new scientifically proven doctors and professionals are there, PhDs. Those people who are scholars, new age scholars, scientists, we have to accept them also. They have done studies on that. And antiemetics. There are so many, n number of, only we talk about the Madhyapal Rasayanam and Ardraka, that is ginger, Musta, chamomile, cayenne, cloves, dill, fennel, gentiana, and ginger, lavender, meadowsweet, peppermint, white horsewood. These are the so many herbs, Western herbs, Indian herbs, Asian herbs, Chinese herbs. There are so many floras are there, native floras. When I was interesting that, when I was in Peru, Lima, Peru, to teach the medical doctors there, 80 medical doctors who are going to the training program in Ayurveda. 5 days of training program. And this government of India, Indian Consulate General has invited me to go there and teach the program there for them, medical doctors. When we are teaching them, there are the plants which are flora, which is very, very good, similar like a Pashana Bheda. Locally, folklorally, they use the medications like that. There are so many medications are there which are very effective like that, it can work. Antidiarrheals, Bilwa, Kalamega, Koteja, these are all scientifically proven, textbooks has proven like that, and scientifically proven herbs. I'm not putting all the references here. Laxatives, Ashwagandha, Haritaki, it has shown. Stimulant laxative, Erendataila. Anti-ulcer preparations, and Vacha, and Bilwa, Shatavari, Nimba, Haridra, Musta, Mandukaparni, Estimadu, Tulasi, Vibhitaki, Guduchi, Ashwagandha, and Shunti. These are the anti-ulcer drugs identified in the Ayurveda. Anti-obesity drugs completely. Gugulu, Musta, Vibhitaki. These are the things are there. How fast we can act upon that, and intestinal system, it can work on the system. And hepatoprotecting, cirrhosis of the liver and hepatitis conditions. So there are so many. Now we have seasonally we get hepatitis cases like that, more and more cases. In hepatitis C, A, B, C, what level it works, what virus it level it happens. Antivirals also there. Kutiki, Pipli, Erinda, Manjista, Arjuna. I teach these people, students, that here, actually today I am going to talk about the Ayurvedic herbs for the heart. Ayurvedic herbs for the parasites. Ayurvedic herbs for the IBS, various conditions, how this effective the modern medicines Ayurvedic medicines can work. Cardiovascular system, Arjuna, Haritaki, Gokshura. How they are effective, diuretic effect of the Gokshura is there, but at the same time, it is also cardioprotective tonic. Antihypertensive. In what levels it is happening? Beta blocker level, angina level, or simple essential hypertension level. There are so many levels we can work into that. And Rasona, Kalamega, Nimba, Musta, Bringraja, Tulasi, Brumyamalaki, Bhubitaki, so many herbs are there, which can be very well used in the system. Diuretics. Plenty of diuretics we have. Shardhunika, that is called Mesha Shringa. Bhumiyamalaki, Erinda, Gokshura. These herbs are very well used systematically in our system. Scientifically proven. Anti-atherosclerotics. Atherosclerotics. If the hypertension conditions, those conditions. Rasona, garlic. We talk about that. But how this asana is going to affect on the system? How much their levels are come down by giving these things? I don't care about only one formulation. You can come up with a compound preparations. Because they may be isolated something. You can work with the combinations. When you are working with the combination, come up with the formulation. That formulation is fast acting and blood pressure has came down. Scientifically proven with side effects. I always expect you from the giving in side effects. Turmeric, Amalaki, Pippali, Ashwagola, Arjuna, Bibhitaki, Methika, Shunti. We have to go into this right out. Respiratory system, asthmatics, bronchodilators, antitussives. Vasa, Brahmi, Shallaki, Haridra, Tulasi, Kutiki, Pippali, Shatavari. These are the herbs that are very commonly used and scientifically proven. And if you go into any anti-tussive effect of the Shatavari, anti-asthmatic effect of the Haridra, in PubMed, so many publications are there. These are the things what is happening. We are telling the people, oh, Ayurveda is scientifically proven. On the paper we are writing, but clinically we are not able to prove it. We are not able to prove clinically on the patients. This is the thing is very, very important on the patient. Number of patients, not like one patient. Anecdotes, we are telling that one patient we treated Dr. Shekhar, one case report. Nonsense. We wanted to have more data, at least 5,000 patients in each case. Then only we can show how many people responded very well. None of the institutions in India or any other institutions in Ayurvedic schools, they have not done 5,000 patients on the study. This is the thing, randomized studies, more clinical studies are done, more research has to be documented like that. That's the thing important like that. Central nervous system, analgesics. There are plenty of analgesics Ayurveda mentioned. Vacha, Nimba, Brahmi, Shallaki, Brangaraja, Vidanga, Kapikachu, Tulasi, Bhumi Amalaki, Eranda. There are plenty of herbs are there which are very, very helpful for that situation, which can be work on the analgesic effect. Why can't we prepare the analgesic? So whereas we can go there, Volini and the medications are there, particularly anti-analgesic medications, pain, sports medicines, the sprays and those type of things. Why can't we prepare something like that with extracts, with fast acting? Antipyretics. I have not seen anything which is able to reduce the fast acting of temperature. There are some studies people are doing like that. Oh, the effect of Godanti Basma, antipyretic effect of Godanti Basma. Okay, come on. Samira Pannagaras, Sitamsaras, something like that they have given. So how much temperature goes down? The temperature is 104 degrees temperature. Where it goes down? How much time it takes? How the action is taking place? What are the side effects to notice per patient? How much dose has to be fixed? Weight, body weight, and dose. All the studies are done properly. Modern medicine has given a clear-cut picture for us. It's a pathway. We don't need to reinvent the wheel. It's very easy to work on that. The platform is created for us. We have to work on that and Ayurvedic formulation to re-establish, properly do it. Then only we can able to show the scientific studies. Anti-inflammatory, arthritic and rheumatic conditions. Amavata Ras, you give it to some patient, he will be taking a tons of tablets, but still it's not affecting. After some time, what happens? The patient will have a high levels of lead and mercury in these things, so that is banned. You cannot use it. That is the way it goes, Ayurveda. Ayurveda medicines having a lot of side effects like that, they say. That is true. One should not be used recklessly without having any consulting of the qualified Ayurvedic physician, should not be taken medications. Nothing to be taken under the supervision. Even they are taking Triphala also, they have to consult their doctor, Ayurvedic doctor. Ashwagandha, if they are taking, now you can see that everywhere it is available. Amazon it is available, any tablet is available. Everything is available in the market. Anybody can use it. Like a CBD oil in America now, all countries in Canada and all the people are using. I get every day 5 or 6 calls like that, and CBD oil. I ask them that I wanted to sell it to me. Then I ask them that what is the side effects of this medication? No, none of the side effects. Then I am not going to buy from you. We need to know the side effects. This is the thing is very important. Muscle relaxants, Shardhunika, arnica oil, turmeric, Epsom salt, CBD oil, capsaicin, and peppermint oil. These are the oils, muscle relaxants. We need to work on the muscle relaxants. Anticonvulsants, anti-epileptics. Memory enhancers and learning enhancement, Brahmi, Ashwagandha is very proven like that. This has to be taken into the consideration. Kapikachu, anxiolytics, anti-stressors. These are the things, Tulasi, Guduchi, Ashwagandha. How much Tulasi can affect to the Tulasi Swarsa if you give, what is the changes are happening. And Tulasi in a caplet form, you give, how the changes of stress is reduced. We need to have documentation. How much changes are happening in that. So Tulsi is very good. Tulsi Swarasa is very good. No, we don't know. Adaptogens. There's a lot of adaptogens are there. Shatavari, Ashwagandha. Aphrodisiacs in male. Kapikachu, Ashwagandha, Gokshura has shown. CNS stimulants and CNS depressants are there. Anti-diabetics. We always talk about the diabetic condition. Whether you are able to cure the diabetes? No. Asthma, can you cure it? No. These are the apirogas, palliative disorders. And hypoglycemic conditions, what are the helps are there? How the glycemic levels are, the recording, you can do it. How the bilva extract taken these things, how the levels are coming down. And that is the thing we need to look into that. And constant, strong, long-term relationship, long-term effect on the medication, on the drug, on the herb. Kapikachu, Tulsi, Amalaki, these all, I have collected these things, all scientifically proven drugs, which are Ayurvedically proven drugs. Malignant diseases like anti-cancer, cytotoxic effects are there, and supportive. Amalaki, Maricha. Like recently, they have studied on this turmeric, curcumin, having a very good effect on the cancer patients of the breast cancer. Why we are not able to bring it, that one, in cancer therapy? Maybe coming to the more and more effective drug thing. Still the chemotherapy, radiation, all the therapies are going on. Why we are not able to bring these things, regression of the disease condition like that? Chemoprotection, immunomodulators, Bilva, Rasona, Kalmega, Shatavari, Shallaki, Mandukapanni, Centella asiatica, Boswellia serrata, Asparagus indica, Andrographis paniculata, Allium sativum, and Eagle marmelos. These are the plants which are proven, scientifically proven. Chemoprevention. There are plenty of things are there. Haridra, Kutaja, Tulsi. Antioxidants, free radical scavengers. These are also very effective. And anti-mutagenic activities. Infectious conditions, now virus and everything, antibacterials. Bacteria is there, immediately what we do? We will go to the allopathic medicine. Whereas Vacha, Vasaka, Rasona, Shatavari, Musta, these are the things are there. How much effect is there? Safe antibiotics, safe herbal antibiotics, you can create it. Studies has to be done, and that has to be administered properly. How the administration has to be done. This is the thing we need to do it. Antibiotic resistant modifiers, Chitrakamula, antifungals, antituberculars, and antivirals. See, now we are talking about viral drugs. Rasona, Kalamega, Nimba, Mandukapanni, Haridra, Estimadu. These are the herbs are antiviral drugs. We have to work on that. From this, you can come up with vaccines. Come up with a vaccine which is having a very effective prophylactic effect is there on the people who can affordable, cheaper, safer, as much as safer. Some side effects are there, of course, but why can't we do it? This is the thing, you have to collaborate with Ayurveda doctors, Ayurveda professionals, researchers, and government media, Ayush Ministry, and ISM, all the things they have to work on these things. Collaborate with them to work on that. Antiprotozoals, insecticides and insect repellents. These are the things which you have to work on that. Antihelminthics, Rasona, Kalamega, Vidanga, Eranda, Shunti. Don't look into the shortcuts. Look into the bigger picture. More studies has to be done. More documentation required. More side effects has to be recorded. And then Ayurveda science will grow. And it will show them to the public and to show the medical doctors. And then they believe it. The reason is that they are not believing. I have physicians in my family, Western trained physicians, highly well educated ophthalmologists and urologists and all the doctors and neurologists and all the doctors are there in practice in America. What we can show to them, this is the thing: reproductive drugs, anti-fertility drugs, estrogenic drugs, which are herbs, Haridra, Musta, Erinda, galactagogues, Shatavari, Erinda. Where is the galactagogue formulas? Which you look into that. Spermatogenic action, urinary system. Every system we have a scientific data is there. Allergies, anti-anaphylactics, injuries, wounds, wound healing promotion. So this is the way we have plenty of documentation is there. I am talking about scientific data is there with us. We have pharmacologists are there who are ready to work with Ayurveda doctors, who are interested to show the efficacy of these things. We are not here to blaming the other systems of medicine here. We have to collaborate with them to work with that and open-mindedness like that to bring them more and more. Side effects are always there. Side effects to be accepted like that. You have to explain. Some of the side effects like that, a feeling of dizziness, not lightheadedness and all these things, that's far fine. He will be okay. Patient will be okay. It has to be there. Like yesterday I was doing an Abhyanga and Swedana. I have given two signs that if your heart palpating, let me know, I will stop it. Then after that, I put him there in bed. And then he rested for some time. He is quite good. And after that, he said that I feel so good. Heart palpitation. I know that. I noticed from these things, documentation shown like that, heart palpitation. And we have to give carefully about that. People who are hypertensive patients and all the people, we have to be careful what we are giving, how you are doing. We need to have more stronger foundation is required. More scientific studies are done. And then more research has to be done. Then only we are able to successfully bring the Ayurveda into the Ayurveda flag in the global platform. Otherwise, we are not able to bring the Ayurveda platform, and Ayurveda will be only sustained to the only subcontinent of India, only limited number of people only using. And we need to have documentation is important. Without documentation, we can't do anything. Side effect has to be noticed. Thank you very much, all of you. If you have any questions, I will be happy to answer for those questions. Sorry for keeping you extra time, 25 minutes extra time I have taken, but there's a lot of subject is there. I'm not here disencouraging the Ayurvedic doctors, our profession, our health. I have a respect towards the system of health, but we need to innovative way. We have to go through that. And you need to work with all the pharmaceutical companies, those who are ready to work with us, and they can be innovative way to come up with new formulations with scientific data, with scientific proven like that. Then they will be happy. More sales will be there. Global economy bring it more. More herbal products and can scientifically proven drugs can be bring it like that into the world. Not only exporting to the only one country. Export, import can happen worldwide. That is the thing, beauty of the Ayurveda is that we have to work on that. Thank you very much, all of you, for giving a great opportunity for me to speak about that. And if I am hurting anybody, I'm sorry for that. And I'm frank, I wanted to tell you clear picture message to you, all of you. That is my vision, like they're not insulting any doctor or professional or college or institution or government or Ayush ministry or anybody. I'm not insulting anybody here. I am saying that if they are taken personally, that is their bad luck. And the thing is that personally don't take it. This is the critic I am giving, hard way to learn more. So this is the way we have to learn. We have to reinvent like that. I am always, I tell my patients that I'm a student of Ayurveda. When you say yourself a student of Ayurveda, then you learn more. Namaste. Thank you.
Namaste, sir. Dr. Sarveshwar. India, I feel that I am a student in front of you. So we have
Thank you, sir. Thank you.
witnessed your vision and mission, and also a lot of insight. This program is open for UG, undergraduate, postgraduate, PhD, and also the faculties.
Very good.
I hope you have reached Karnataka to Mysore and Mysore, sir. No doubt about it.
Thank you. Thank you. Thank you.
And you have you got your all knowledge source from IPGTA Jamnagar.
Its institution is not important here. Where you study in
Nalanda of Ayurveda. If
it is not institution.
Very true. But definitely.
So I don't feel like that way. That it's the thing is the institution has not taught completely. Institution has flaws are there, and problems are there. Institution is not a thing. Whether the Benares University or in Karnataka University, Rajiv Gandhi University, or NTR University, or any university. University is not important here. That gold medal is not important. Who is a student get the gold medal, or who is a top ranked in the student like that, or high professional like that, who are there in the high position like that, that's not important, or somebody who received the Padma Shri award or Padma Vibhushan award is not important here. So main thing is that here important is that here how the knowledge has gained, how many awards you received, that's not important, how many degrees you acquired, that's not important, how the science has contributed to that, how the results has reached that. The ultimate goal is that a patient. Patient is the best textbook in the world. Patient, how he feels, how he benefited, and that is the thing. So for example, a patient comes with this thing. Yesterday, I have a patient with this thing, an asthma patient, and how the changes are happening there, and these things. And she said that this is the improvement came up like that. She was so happy to see that. She, first of all, I asked them what improvement have noticed. What improvement not seen? Improvement we have to see. What improvement not seen, we have to work on that area. That is the way it works. Definitely, our BIMS students, postgraduates, and PhD scholars, and everybody start working on that area and collaborate with them. I'm not saying that you have to study the whole pharmacology. I don't want you to go to the pharmacy college. There are so many pharmacy colleges are there, institutions are there, deans are there. You work with them. They will be happy to work with you. And then pharmacokinetic effect is there, every drug and everything, and identify them. Each and every institution bring up some strong formulation and work on that, and you will see the very effective results are there. That documentation is required and going to show to the government. Government is the body. Government is made with us.
Sir, you have focused on metabolism, small intestine, and liver so nicely to the ocular route to the liver. You have given a link. I think our viewers are very clear that the message you have given here. So, lot of anjanas, lot of oral, ocular collyriums are linked to the effects.
We need to show. We need to show them scientific data of that way. All the collyriums, how they are affecting on these things, SGPT levels, SGOT levels, and the serum bilirubin levels, and how it is affecting on these things. And it has shown. It has shown not on only one patient. It has shown to the 5,000 patients. Then only I can believe it. By saying the anecdotes like that, Charaka, Susud, Vagbhata, and Chakrapani, Slokas, that is not a way. The science is not like that. The patient is not ready to listen those things. These stories, cock and bull stories, we need to stop it. We need to work on that. The scientific data has to be shown. Then only people will start to listen to things. And we are working hard to make it successful.
Maybe around. Sir, your message is very clear in India. Probably in the since last decade, maybe in the last 7 to 10 years, when the ministry has come, ministry in India has come up. So Modi ji, Honorable PM Modi ji, and that team, that is minister, and also Kottachaji is now leading this as the secretary, the professional technical person, by the Rajesh Kottachaji. Things are getting line up now, sir. Research cannot be done in one day. It's a lot of teamwork,
Yes,
and
it
also
is definitely
it
because
takes a lot
Rajesh
of
Kottacha, Rajesh
going on
Kottacha
similar lines, sir.
Dr. Rajesh Kottacha is my batchmate. We studied together. We are the same batchmates. We are all studied together in the same
Very
institution
true.
like that.
Okay, yours. Yes,
Dr.
yes.
Rajesh Kottacha,
That
Dr. Pratar Singh Dhiman,
that
Dr. Manoj Nesri, Dr. Tanuja Nesri, Dr. Sanjeev Sharma, we are all classmates. We are
all your
proud.
contemporary has now taken the Ayurveda.
We
Yeah.
are proud of that. They are doing a wonderful job together. All the people, our team of people are working together and everything. So what I am saying that I'm not blaming one doctor or one profession, one system or government here. I am working in this way like that. I wanted to show that way that to tell the people like that, to work on that, bring the people together, and we need to work on the herbal vaccines. Now this is the high time for us to come up with a herbal vaccine. Why can't we work in herbal vaccination?
Sir, when
So we can't do it. We have to take the pharmacologist. There is a wonderful expert in the
Sir,
field
I
of
am from a Vaidya family.
Yeah.
From Puri, Odisha. Yeah. Maybe in the 25 years before, if I remember, there was injection for ashwagandha. The injection for Holland anti-dysentery. That's India, particularly some states. But because you know how this the research document is required, I think that is not there in the practice now. But your message is very clear. I think in the new generation, budding doctors and PhD scholars, they'll take further, sir. It's a teamwork. Sir, whatever knowledge you have submitted, it is for great cause because this is 105th Jayanti of Pujya Simho Mela we are doing, Kumbh Mela for the knowledge, and this is submitted to the Lotus Feet, Mysore. We have deepest gratitude to your good self. Thank you very much for joining from long distance and sharing your rich knowledge, sir. Thank you, sir. Thank you.
Thank you.
Namaste.
Namaste. Namaste.